Today we're going to show you how to do a temporal brow lift. This is part of an endoscopic brow lift, but it's just for the outer corner of the brow. As we age, a lot of people notice that the outer corner of the brow will start to drop, and that accentuates the lines and wrinkles in the crow's feet. So what we're going to do is through a small incision up behind the hairline, come down underneath the skin, and just lift up that outer corner of the brow. The incision is up behind the hairline, so it's not visible after the surgery, and it really helps to recreate the natural contour of the brow. Okay, what we're going to do here is just lift the outer corner of the brow with a temporal brow lift. This is where our incision will be, and what it'll do is just help pull up this outer corner of the brow. So what we'll do is a beveled incision here. Going down to the, we call the deep temporalis fascia. So we'll just spread until we see the fascia, which is this glistening white covering on the muscle. Then we know we're in the right plane. And if we lift up here, we know that we are in the right plane because nothing is moving. We'll take our elevator, start to dissect up. We're going to go all the way down to the orbital rim. Free up everything. Our rim is right there, so we want to make sure we're well released. And when we do an endoscopic brow, we also do the top part and get the central part of the brow, but we are not doing that here, we're just doing the outer corner. So we just call this a temporal brow lift. And you can just sweep with your finger. Just make sure it's all free. And this is what you want to lift up, is this part here. Okay. Then what we'll do is a couple of myotomies, which means to cut through the muscle a little bit. That frees it up a little bit more. It also cuts the nerve that comes over to your corrugator, which is what produces the frowning. So this sometimes helps with your frown lines as well. And we'll just check again. Make sure that everything's nice and freed up here, so we can get a lift there. Sometimes people are worried they're going to be way overcorrected. It just doesn't happen. It'll usually sink down a little bit, so you usually get maybe about 4 to 5 millimeters of lift. You will not get a surprise look when you're done. And what's nice about it is that the incision is back behind the hair, so that you won't see it once it's healed. So we're going to take a suture through the fascia. You want to get a fairly good bite. You don't want to be too superficial, or it'll show. You'll get a little dimpling. The suture will dissolve eventually, so that dimpling will go away. I usually put in 2 of these. I said this is a dissolvable stitch. Okay, so we'll put in one more of these sutures through the fascia here. Let's try so you can see that's the fascia. The hand may get in your way here. Take a bite through the deep tissue again. Pull that out. And then you can see as we pull on this, see how it pulls up on the brow tissue. So we'll just tie these. Tie this down. Now, at this point, you definitely have some extra skin. Some people leave it, some people take it off. I think if you take it off, you get a little bit more of a secure lift. Now you don't want it too tight, or you'll get a bald, and you could get some hair loss in the scar. So you just do a beveled incision here. And here as well. And just take off where so that they meet, so that they oppose nicely. So take a look and stop any bleeding. This will stay in for about a week to 10 days. See, it's behind the hairline. You can see you get a nice lift to the brow, but it's a very natural lift. We're doing this under local sedation today, but you can also do it with just straight local in the office. And now we'll do that on the other side as well.